Welcome back to the channel where medical topics are made simple. In this video, we're going to talk about how to use the PERC rule for pulmonary embolism, or PE, and what the criteria mean. You'll also learn a simple mnemonic to remember the PERC rule criteria. And by the end of this video, you'll know everything in this PERC rule table. There's a practice question at the end, so make sure to watch the entire video. You can find this topic in our book and follow along, which is linked down below. You can also find the notes for this video linked down below. So what is the PERC rule for pulmonary embolism? PERC stands for Pulmonary Embolism Rule Out Criteria, and it's a set of criteria used to rule out a pulmonary embolism in low-risk patients without the need for further diagnostic testing, such as a D-dimer or imaging. In other words, you're taking a group that's already low risk for a PE and applying the PERC rule to potentially eliminate the need for unnecessary testing, such as a D-dimer or imaging. Now, we said the PERC rule helps rule out a pulmonary embolism. So what is a pulmonary embolism, or PE? It's a blood clot or other substance that travels to an artery in the lung and it blocks the artery. And we can use the PERC rule to help rule out a pulmonary embolism in low-risk patients. So how does the PERC rule work? The PERC rule uses a set of criteria. If any of the criteria are present, then the patient is PERC positive, and the PERC rule cannot be used to rule out a PE. If no criteria are present, then the patient is PERC negative, and the PERC rule can be used to rule out a PE in low-risk patients. Now, this is important, so listen up. The PERC rule is only used on patients who are already low risk for a PE. We're going to bring all of this together shortly, but first let's walk through the PERC rule criteria and then we'll talk about how to apply it. There's a memory trick mnemonic at the end to remember all of this, so keep watching. First, we have age 50 or older. The reason for this is because the risk of PE increases with age, so younger patients under 50 are lower risk for PE, and older patients are higher risk for PE. So if the patient is 50 or older, then the PERC rule cannot be used to safely rule out a PE. Remember, the PERC rule criteria must be negative or absent in order to rule out a PE. Next, we have heart rate greater than or equal to 100. If the patient has tachycardia, meaning a fast heart rate of 100 or greater, then the PERC rule cannot be used to rule out a PE. The reason for this is, remember, a PE is a blood clot or other substance blocking an artery in the lung. This will cause the heart to beat faster from stress on the heart, low oxygen levels, among other factors. Next, we have oxygen saturation less than 95% on room air. If this is present, then the PERC rule cannot be used to rule out a PE. The reason for this, again, is a PE is a blood clot or other substance blocking an artery in the lung. This obstruction prevents blood from reaching the alveoli in the lungs to pick up oxygen. In other words, the lungs are getting the oxygen, but the blood is not getting to the lungs to receive the oxygen. This creates a ventilation perfusion, or VQ, mismatch, which can cause low oxygen saturation. Next, we have unilateral leg swelling. The reason for this is unilateral leg swelling can be a sign of DVT. A DVT stands for deep vein thrombosis, which is a blood clot that forms in a deep vein, typically in the leg, and this can lead to leg swelling, redness, and calf pain, to name a few. Remember, we said a PE is typically from a blood clot, and this blood clot most commonly originates in the leg and breaks off and travels to the lung. That's why unilateral leg swelling, which could be a sign of a DVT, is part of the PERC rule. If it's present, then the PERC rule cannot be used to rule out a PE. Next, we have hemoptysis, which is the coughing up of blood or blood-stained mucus from the lower respiratory tract, such as the lungs. Remember, a PE involves an artery in the lung being blocked. This can lead to pulmonary infarction, which is when the lung tissue dies from lack of oxygen from the blocked artery. The pulmonary infarction can cause someone to cough up blood. If this is present, then the PERC rule cannot be used to rule out a PE. Next, we have recent surgery or trauma in the previous 4 weeks. If either is present, then the PERC rule cannot be used to rule out PE. The reason for this is both scenarios increase the risk of blood clot formation. Remember Virchow's triad, which are 3 factors that increase the risk of blood clot formation, called thrombosis. One of them is stasis of blood flow. Recent surgery or trauma can lead to bed rest or immobilization, which can cause the blood to be stagnant, which can form blood clots and cause a PE. Trauma can also lead to vascular injury, which is another component of Virchow's triad, and this can increase the risk of blood clot formation as well. This is why recent surgery and trauma are included in the PERC rule. Next, we have prior PE or DVT. If a patient has a history of PE or DVT, then the PERC rule is positive and it cannot be used to rule out a PE. Finally, we have hormone use, such as estrogen therapy, oral contraceptive pills, among others. If present, then the PERC rule is positive and it cannot be used to rule out a PE. The reason for this is hormone use can increase the risk of blood clot formation. Again, let's go back to Virchow's triad. Hormone use can lead to hypercoagulability, which is one of the 3 factors that increase blood clot formation. Now that we've gone through the criteria, let's talk about how to apply it. Remember we said the PERC rule can only be used on patients who are low risk for a PE. So first we have to determine, is the patient low risk? You can do that using Wells criteria for pulmonary embolism. The Wells criteria calculates the pretest probability of a PE. To put it simply, it tells you how likely a PE is prior to any testing, which helps risk stratify patients. We have an entire video on Wells criteria linked down below. Make sure to watch that. The way it works is there is a set of criteria, and each of them have points. The points are then added up to give you a total score. The total score then tells you the likelihood of a PE. The one that matters to us is the low-risk group. Remember, the PERC rule can only be used on patients who are low risk for PE. So if they have a Wells score of less than 2 points, then they have a low pretest probability of a PE, meaning they are low risk for PE. A modified and simpler version, called modified Wells, is a score of 4 points or less is PE unlikely, and a score of more than 4 points is PE likely. Again, the one that matters to us is the low-risk PE unlikely group. Make sure to watch our full video on Wells criteria to learn more about how to use Wells. The video is linked down below. Now that we have determined the patient is low risk for a PE using Wells criteria, we can then apply the PERC rule. This helps us rule out PE without the need for further testing. If the patient is PERC negative, meaning none of the criteria is present, then there is a very low probability of a PE. This safely excludes a PE without the need for further testing, such as a D-dimer or CTPA. This eliminates unnecessary testing and radiation. So again, if the patient is low risk for a PE using Wells criteria and they are PERC negative, then the PERC rule can be used to rule out PE without the need for further testing. If the patient is PERC positive, meaning one or more of the criteria are present, then the PERC rule cannot be used to rule out PE, and further testing for PE should be considered. Typically, this starts with a D-dimer. A D-dimer is a blood test used to rule out blood clots. It measures protein fragments released when a blood clot dissolves. If the D-dimer is positive, meaning there could be blood clots, then consider imaging such as a CTPA, which is a CT pulmonary angiography of the chest. If the D-dimer is negative, then further testing for PE may not be necessary. So again, if the patient is low risk for PE using Wells criteria and they are PERC positive, then the PERC rule cannot be used to rule out PE and a D-dimer should be considered. Here's a mnemonic to help you remember the PERC rule criteria, and then there's a practice question, so keep watching. You can use the mnemonic had clots. This is a common mnemonic used in many resources. The H stands for hormone use. The A stands for age greater than or equal to 50. The D stands for DVT or PE history. The C stands for coughing up blood, called hemoptysis. The L stands for leg swelling, unilateral. The O stands for oxygen saturation, less than 95%. The T stands for tachycardia, and the S stands for surgery or trauma in the past 4 weeks. Here's a practice question. Try to figure out if the patient is PERC positive or negative. A 52-year-old presents with shortness of breath and chest pain. Their heart rate is 110. Oxygen saturation is 99% on room air. They have no unilateral leg swelling. They deny coughing up blood, cancer history, recent surgery or trauma, prior PE or DVT, or hormone use. You have already determined they are low risk using Wells criteria. Hit pause in the video and determine if the patient is PERC positive or negative and what the next steps would be. The patient is PERC positive. First of all, we're able to use the PERC rule because the patient is low risk for PE using Wells criteria. However, the patient is PERC positive. They are older than 50 years old, and their heart rate is greater than 100. Therefore, the PERC rule cannot be used to safely exclude PE, and further diagnostic testing, such as a D-dimer, should be considered. If you found the video useful, please hit that like button and let us know in the comments. You can find the notes for this video, along with our book and flashcards, linked down below. Subscribe to save time studying and not miss out on future videos and notes. Thanks for watching, and hope you return for future videos.